Minimum pricing for alcohol was introduced in Scotland in May 2018, and it was kind of unusual as a health policy insofar as it had very specific predictions made about what would happen in the first year. Specifically, we were told to expect 58 fewer alcohol-related deaths in the first year and 1,299 fewer alcohol-related hospital admissions. Now, last year we got figures from the Office for National Statistics that showed a slight increase in the number of alcohol-related deaths in Scotland and a decline in the rest of the UK, which wasn't obviously very encouraging for advocates of minimum pricing. However, minimum pricing only began in May, so the calendar year isn't that much use. What you really need are the monthly statistics. They hadn't previously been released, but I've got hold of them and we published them at the Institute of Economic Affairs today in a short briefing paper. They do indeed show a decline in alcohol-related mortality in Scotland after minimum pricing came in, but in the same period you see exactly the same rate of decline, about 7%, in England and Wales. So whatever the cause of the decline in Scotland, it doesn't seem to have had much to do with minimum pricing because England and Wales saw exactly the same effect and they don't have or didn't have minimum pricing. I also look at alcohol-related hospital admissions. They didn't go down in Scotland, they actually went up a little bit. And I look at the cost of the policy to Scottish drinkers. A lot of politicians, I think rightly, were concerned that the policy was going to be regressive, it was going to clobber the poor hardest, and that indeed does seem to be the case. The poor are having to spend a greater proportion of their income for these higher alcohol prices than the rich, and even an average Scottish household, or even a moderate drinking Scottish household, is paying around about £50 to £60 extra per year for this policy. And what are they getting for it? Well, in terms of health, as yet there is really no sign of the kind of reductions in either hospital admissions or death rates that were predicted by some of the modellers beforehand. So the evidence to date seems to suggest that minimum pricing has been an expensive flop.